Relieve, Respond, Revive. WSFL-TV presents The Rebound, South Florida.
As vaccines give us hope, and we hope to get back to a sense of normal, we need to make sure that our facilities can recover financially.
The financial fallout of the pandemic packs a powerful punch to long-term facilities. What Florida families need to know. Millions of unemployed workers face surprise tax bills, how some are struggling to pay, and what help could be offered in the new COVID-19 stimulus plan.
I always tell them, you don't really know how strong your words are. You're so inspirational.
A local woman putting health first in underserved communities. How her desire to make a difference and change lives is being felt, one vegetable at a time. The Rebound South Florida starts right now.
Tonight, as if Florida's long-term care industry hasn't endured enough, now sticker shock over just how much the pandemic has cost and why the only answer to surviving this money pit will likely put the burden on you. As Florida's long-term care industry slowly rebounds from the pandemic, it's now on the brink of another disaster.
How dire is this situation?
This time, money.
I think if we don't see us start rebuilding our occupancy, I think you could see some challenges where we might see some facilities that close.
We're sitting here going, what are we going to do?
After a year of living and working in crisis mode, Florida's industry for the aging is in the red, with losses estimated at well over $650 million, according to leaders.
The long-term care sector has been one of the hardest hit from COVID-19 pandemic.
During a recent meeting in Tallahassee, the state's leading nursing home association made a first plea to state lawmakers for help.
Quite frankly, a workforce shortage plus COVID-19 has put us in great crisis.
Medicare and Medicaid typically pay for nursing home residents. While additional federal funding helped cover some pandemic costs, it wasn't enough to cover the historic costs of COVID testing, PPE, and staffing needed to survive the last 12 months. Couple that with vacancies that have plummeted to historic lows and have yet to rebound.
They're wondering how they're going to make it. They're running out of money.
For the state's 3,000 assisted living facilities, federal and state money isn't a natural pipeline, which means without some help, closures and rate hikes are likely.
How do you survive without passing on the cost to residents and their families?
Exactly.
It's too early to predict what rate hikes could look like, but a recent study found the average monthly cost for nursing home care in Florida was up 11% since 2016, nearly $1,000 more than the national average.
As vaccines give us hope, and we hope to get back to a sense of normal, we need to make sure that our facilities can recover financially.
If you're looking into long-term care for yourself or a loved one, talk to an administrator. You might get a deal because these centers are so desperate to fill vacancies. Katie Legrone, WSFL TV.
Millions of Americans who were unemployed last year and many who are still unemployed right now are starting to get surprising tax bills from the IRS over unemployment benefits they received. Here's a story of two people and their struggle to pay these bills, but also some insight in what's included in the next stimulus package that could help them and so many others pay these unemployment tax bills.
More than 20 million Americans lost their jobs during this pandemic. 9 million are still out of work, including Dottie Ullman and Josh Davenport.
For the pandemic, I was in dire straits, working 3 jobs.
I was a freelance entertainment electrician in the corporate event space.
Both Dottie and Josh lost all work at the beginning of the pandemic and have struggled to find a job since. Despite unemployment benefits, they've accumulated debt. This month, they are 2 of millions of people getting hit with the biggest bill yet, a tax bill for their unemployment benefits.
I will probably owe more tax this year than I have in the last decade. I would say I'm going to probably be around $6,000 to $7,000 at least.
Dottie's estimated tax bill is for taxes on the money she received from unemployment and a life insurance plan she had to cash out last year.
I've actually filed and amended my taxes already. The first filing, I had a bill for around $2,800.
Josh's tax bill is only for state and city taxes. Like most people who are looking at these bills from the IRS, Josh is waiting for potential federal tax relief from Congress.
The bill as amended is passed.
In the latest stimulus package, unemployed Americans will get $300 in weekly benefits instead of the $400 that was proposed, and taxes for the first $10,200 of unemployment compensation received in 2020 will be waived.
It's helpful. It means about $1,200 to $2,400, depending on your tax bracket, might come back to you, or you at least won't owe it. But people have collected more than $10,000 in benefits this year. And so they're still owing tax bills.
Stephanie Fried is with the advocacy group Extend PUA, which pushed for Congress to do more at the federal level and is now pushing for states to waive some or all of the tax liability for those who are unemployed.
So without state level forgiveness of any unemployment, I'm in a little bit of trouble.
Even with potential tax forgiveness on the federal level now, Josh doesn't know how he can come up with $2,800. He's going to file an extension on the tax bill, which will add fees and interest, and just hopes he can pinch pennies a little more.
I know that Lincoln is screaming on that penny every time I stretch it out.
Dottie knows she can't pinch further to pay her tax bill.
I think I'm going to go into denial.
Which isn't an actual solution for her or anyone. At the very least, experts recommend even if you can't pay, file your taxes and an extension. It will result in fewer penalties and fees. I'm Alicia Nieves reporting.
Helping those in need. A woman and son duo going above and beyond to help homebound seniors through the nonprofit Meals on Wheels South Florida. How you can help too.
If there's one thing the pandemic has confirmed here in South Florida is that people care about their communities. For the past year, we've been doing stories on people helping people, and the stories continue. Tonight, a dynamic mother-son duo volunteers for Meals on Wheels South Florida, and they've never stopped helping those in need.
Bye now.
Stay safe. Rita Martin has been volunteering for Meals on Wheels South Florida for 14 years, dedicating her days to serving homebound seniors in Broward County.
People cannot get out, cannot go to the grocery store, maybe they don't have transportation, and they're very appreciative of the boxes we give them.
Rita's work in the community shined so bright, she won the Broward Senior Hall of Fame Award in 2012.
Some of these people do not have family, to come and help them out.
Rita's son, Paul, started volunteering with his mother 2 years ago.
Thing that really allows me to spend time with my mom, helping her do what she loves doing, but also being able to contribute to the community and help seniors.
The dedication of the mother-son duo never stopped them from delivering meals during the pandemic.
I know a lot of our volunteers who are older decided that they needed to stay home for their safety and for the safety of their clients. But Rita and Paul stuck with it the whole time.
Down 250 volunteers, Mark with Meals on Wheels says they're in dire need of help.
Right now we have 250 active volunteers doing meal delivery, and that's down from where we were a year ago. We had almost 500.
The nonprofit provides food and resources to homebound seniors in South Florida. As a result, hundreds of seniors who are home alone have their days brightened every day during what can be a difficult time.
She's my inspiration, and seeing her give back to other people has inspired me in my life to give back and to be kind whenever I can.
I could be one of those seniors. I'm 82 years old, and I could be living by myself. So that's what motivates me.
Meals on Wheels South Florida is depending on donations and volunteers to stay afloat. If you'd like to support the nonprofit's mission, head to WSFLTV.com.
Helping you make ends meet, a local bank is adjusting to better serve their customers, meaning they need help and are hiring both in-person and remote positions with opportunities to grow. Getting through this with stories to help get back on track as we rebound in South Florida.
During the pandemic, many businesses have had to come up with new ways to better serve their customers. At Tropical Financial Credit Union, that means having more people on staff, both in person and on the phone. That's why Credit Union has a number of new job openings they want you to know about.
Our call center has doubled in volume since COVID.
An uptick in services needed by banks in South Florida has opened doors for the unemployed.
Our folks have learned that they could go through the call center And they've also become aware of the usage of the app and online banking. So that's a big plus. But that also means we need more support people there.
Headquartered in Miramar, Tropical Financial Credit Union is looking for 10 employees to join their team. Both in-person and remote positions are available. Elizabeth Jimenez, VP of Human Resources, says the pandemic has accelerated the at-home workforce, offering several back-office positions in the mortgage and lending departments.
The benefit of those positions is that a good portion of them you could work remote. So about 80% of your work time will be home.
Employees like Kim Donnell finding it extremely efficient to work from home.
The time from, getting up, getting yourself ready, getting your things together, getting in the car, getting yourself to work, it's longer than just that commute. And you now have that time back in your day.
For in-person positions, there are 4 available at their branch locations in Miami-Dade, Broward, or Palm Beach, with opportunities to grow.
We need the person, obviously, to be member-facing and be available to the member through one of our branches. The good thing is that we will do everything possible to train them. And, the branch, some folks love the branches and will retire from the branches. But if someone starts at the branches and wants to grow and expand their skill sets, they have opportunities in back office.
What I have found with Tropical, what they do, and they do a great job, is they do take advantage of Zoom meeting opportunities and, even do award acknowledgments via Zoom.
We have all the information you need about what positions are available and how to apply on our website, WSFLTV.com. Just click Rebound. There you'll also find other employment resources to help you with your job search.
Despite millions of people already fully vaccinated against COVID-19, we still have a long way to go before we can return to our pre-pandemic lifestyles. This week, in a series of reports, we look at some of the big questions many have about getting back to normal. We're calling it, When Can I? The pandemic has made mask wearing ubiquitous. In many places, they're a requirement to enter restaurants, airports, and schools. And many are beginning to ask the question, when can we safely stop wearing masks?
I think it's better to think about it as, when can I do X without wearing a mask? And the answer to that question is really different for different activities.
Dr. Emily Landon is the Chief Epidemiologist and Executive Medical Director of Infection Prevention and Control at University of Chicago Medicine.
I think over time, you're going to be doing more and more things without a mask, and less cases come up, and then you're going to have to put your mask back on for more things again.
Landon says it's safe for people who are fully vaccinated to unmask around one another right now.
Once I'm fully vaccinated, can I spend time with other people who are fully vaccinated in my home without a mask? I think that's probably pretty safe.
The CDC issued guidance saying fully vaccinated people can also safely gather with a small group, such as another household, even if that group has not yet been vaccinated, as long as they are not at higher risk. During the 1918 and 1919 influenza pandemic that killed some 675,000 people in the U.S., wearing germ shields, as they were called, lasted years. But historians point out that resistance, inconsistency, and improper masking, coupled with the use of ineffective materials, likely prolonged the need. Texas and Mississippi just fully reopened, rescinding mask mandates to join more than a dozen other states that don't require them.
Personal vigilance to follow the safe standards is still needed to contain COVID. It's just that now state mandates are no longer needed.
Critics say it's too soon. Landon says as positivity rates go down and vaccination rates go up, we will see some mask requirements loosen fairly quickly.
I think this summer, you're going to see a lot of people able to do outdoor activities without a mask on. I think in the fall, you're going to see a lot of places will start relaxing some of their masking restrictions.
But it will be some time before immunity is high enough population-wide for us to unmask in places like grocery stores and restaurants when we're around people who we don't know. Landon says over the next year or two, the mask wearing will not go away entirely. If we see virus cases spike seasonally, like in the winter, mask wearing could be necessary.
I think it's going to be this push and pull, sort of the, riding the waves of the masking.
While it's still too early to throw out your masks, depending on the circumstances and who you're around, you may be able to wear it less and less. I'm Usher Qureshi reporting.
you are a mom trying to feed your kids, you're going to go for that can of Chef Boyardee that is full of preservatives and highly processed foods and sodium and saturated fats and all these things that we know are contributing directly to diet-related diseases in food desert neighborhoods.
In celebration of Women's History Month, we're recognizing local women who are making a difference and touching lives in our communities. How a woman is impacting lives across South Florida by building vegetable gardens in underserved areas.
In honor of Women's History Month, we're highlighting women who've made an impact in South Florida. Tonight, a local woman started a nonprofit and is breaking barriers in low-income communities so residents can make healthy choices.
Anytime families need extra greens, they pop out here and can grab whatever they need.
Asha Walker is the founder of Health in the Hood, a nonprofit that builds vegetable gardens in underserved areas.
We've got 9 farms across food deserts in South Florida. We're mainly in the Liberty City area, Opelika, Miami Gardens, Pinewood, Little Haiti. Those are our central locations.
Food deserts are low-income neighborhoods that are more than a mile away from a grocery store with fresh food. There are over 300 food deserts in South Florida.
If you are a mom trying to feed your kids, you're going to go for that can of Chef Boyardee that is full of preservatives and highly processed foods and sodium and saturated fats and all these things that we know are contributing directly to diet-related diseases in food desert neighborhoods.
Operating since 2013, Health in the Hood serves about 900 families in need, providing fresh vegetables such as collard greens, broccoli, sweet potato, tomatoes, and more.
I would drive home from work and I would take shortcuts and go through Overtown and come from my gym and go home and have a healthy meal and realize that there were moms in these communities that, one, didn't have the resources, didn't have the transportation, didn't have the knowledge, and it made me really angry. And so I put together my skills and background in grant writing and fundraising and community engagement, and I also knew how to grow some stuff, and Health in the Hood was born.
My kids were they were so excited because they were like, I can't believe people grew this in our little neighborhood.
Alicia Fields is a mother of 4 receiving food from Health in the Hood's garden in Liberty City. She met Asha at one of the nonprofit's pull-up pantries. Now Alicia is a volunteer.
When the pandemic first hit, my mind was everywhere. How am I going to do this? How am I going to do that? And after talking with her and just having one conversation, she's so inspiring. I always tell them, you don't really know how strong your words are. You're so inspirational, and she just makes you have a different outlook on life.
Asha's goal is to end food insecurity and teach people how to reclaim their health and food system by growing their own food.
Before we go in and plant a farm, we knock on doors, we meet people in the community, we work with partners, so people really take ownership of the farms and they become their own. So there's not really a set time, there's no open or close, there's no fences in any of our farms, everything is open for the community, and it really becomes an organic process by which people understand when radishes are ready, when the tomatoes are ready to go, they come out and make a salad for that night, and it's really been an organic process that's evolved over the last 8 years.
Since 2013, Health in the Hood has distributed 8,000 pounds of free, fresh local produce to families. There are so many reasons to love South Florida, right? From the awesome culture to the gorgeous scenery. Every week we've been asking you what you love about where you live. Tonight we leave you with Amanda Fuller from Hollywood.
Me and my wife live in Edgewater. We're right on the bay. So in the morning, I drink my coffee out there with my dog, which is nice. So in Plantation, I can do that, but it would be on a lake more. But you don't get that exclusivity as much in a neighborhood in a residential area versus being on the bay downstairs from your place. So I guess I would say that I'm outside more now than I would be living in Plantation.